I had begun my career in healthcare as an account rep or sales rep for a small specialty reference lab. And that was really my onset into healthcare and working with physicians and teaching them about, at that time, it was DNA testing and how they could detect different forms of cancer and low-grade cancer. And so I really fell in love with healthcare and that interaction with physicians and teaching and really learning a lot. At that point, I was probably learning more than I was teaching, a lot of patient physicians. But I really fell in love with the industry, and from there I worked for a large medical manufacturer in the hospital. So again, it was working with physicians, but within the operating room, within the surgical environment, having them utilize our equipment, but again, that teaching and working with the physicians. And then at that point, it expanded my career in that I got to see the OR and the inventory, what was used in the cases, the whole dynamics of really the cost side of healthcare, the operational side of healthcare, inventory, how all that flows. And that experience, observing many hospitals, observing the similarities and the connections, and just having discussions with administrators and materials managers and people in purchasing and the clinicians, the nurses within the operating room, I got to really see this very dynamic environment, right? This is a surgical environment. There's a lot going on. And there, when those patients come into the surgical environment, they need supplies, they need, equipment. But there's also the balance of, okay, is there variation? Is there waste? Is there opportunity to save money? And I got to see those connections being in the OR, working for a medical device company. And just, one day I had a conversation with one of my materials managers around costs in this specific area. It was just this interesting conversation of, are they paying the right price? Or is there some variation? And I gave her some of my thoughts and my insights. Again, it's very discussional, with her and I. And I came back 2 weeks later and she said, you saved the hospital for $250,000 just from some of those thoughts and insights and just pushing me to think differently. And I was thrilled. I think I was hooked then. And then even to this day, it's a thrill to, when hospitals come to us, they know there's an opportunity, and so we dig in, we help them with not just the insights, it's certainly insights, but it's the resources to get that RFP or that contract renegotiation over, to completion. And it's that thrill, that same thrill to say, you thought there was this opportunity. Now we've maybe made it a little bit bigger, and we help them succeed. And that's that same thrill we have today.